Global populations are slowly coming to terms with the new normal. COVID-19 is still here, and public health guardians are urging all of us to not fall into a false sense of comfort where we believe everything is okay. We need to continue to follow the rules and the guidelines. In Antigua and Barbuda, the population remains vigilant, careful, and less fearful. We are coping with COVID-19 in the Caribbean.
In the COVID-19
like leading
social distancing.
Recorded one. Spoke to journalists from St. Lucia, Antigua and Barbuda.
There is no need for fear or panic.
The guardians of public health in Antigua and Barbuda continue to face an uphill battle. Fortunately, the number of active cases and deaths recorded on the island are relatively small compared to the rest of the Americas. Here's the question: can the fear of stigma and discrimination affect testing and the accuracy of active cases? The Chief Medical Officer in Antigua and Barbuda gives this response.
Most times they say in a disease outbreak, you just see the tip of the iceberg. You only get to detect or pick up those cases that would come forward or that a vigilant healthcare provider would report. So you are right. We may not be actually seeing the numbers that we have, the true numbers. And stigma and discrimination can contribute to that because people are scared. People, if somebody has upper respiratory tract symptoms, a cough or a sneeze, people, like last year, they would look at the person differently as compared to now. So yes, persons have been stigmatized, and yes, they may be a little bit cautious in seeking health care or going out if they do have symptoms. And that's unfortunate because COVID-19 can affect anyone. And we really should not discriminate. And persons should live in an environment where they're able to seek health care if they need it and not feel discriminated against.
How does one react when they are in the presence of a person who has recovered from COVID-19? Here's designer and business owner Kelly Richardson's candid response.
Honestly, I don't know, because I've never had that experience. But I think, judging myself as a person, I would try not to make them feel uncomfortable, because I too can get COVID. So I think at the end of the day, we just need to be humane about the situation and put yourself in that person's position. And then I think once you do that, you will act accordingly.
Psychologist Dr. Jean-Michel Ben Dubois sheds more light on the negative effects of stigma and discrimination on our overall wellness.
One of the biggest impacts of stigma and discrimination is its ability to break down our sense of well-being, our general well-being. For example, the simplest thing I can think of, will I get tested for COVID-19? If the stigma and discrimination has grown to such a magnitude, regardless of what the health officials tell me, will I want to know, knowing that I will be pushed out of the box? And that's one of the very first ways in which stigma and discrimination affects us. We don't want to know. Then you talk about the other aspects of how you isolate yourself. If you suspect that you have, you isolate. Why should I bother and get tested? Why should I get treated? Why should I tell anyone? Because they're going to treat me different.
PAHO and WHO country representative for Barbados and the Eastern Caribbean countries, Dr. Itadis Gibre, weighs in on the effect of social stigma and discrimination on COVID-19 testing.
COVID-related stigma may reduce the number of people who may access health services because of the stigma and discrimination. That may hamper the response as well. However, we know that 80% of the cases are mild. So individuals may not seek health services regardless of the stigma or discrimination. However, for those individuals with severe illness, they may not hide those illnesses. They have to seek health services. Therefore, they would come to health services. However, when we look at those individuals who may have milder symptoms and then who may not be taking the necessary protective measures, may continue to spread the infection. When we look at this, always there could be some numbers and figures which we may not be able to reach. Overall, these numbers are very, very small. And then over time, we should be able to identify by testing, contact tracing, and then quarantine or isolation of the cases who may come to our health facilities.
What is the possibility of island-wide testing?
It's not realistic to test everybody. With the particular test that you would use would be what it is you're trying to find out. And there are several tests available for COVID-19. You have the RNA PCR test that actually looks for the genetic material of the virus. Then you have an antigen test, which just looks specifically for certain proteins that the virus might express. And you have antibody tests, which actually measures how your body responds by producing antibodies to the virus. And each of those tests would have their advantages and disadvantages. The DNA PCR or the RNA PCR test is really the gold standard. That's the one that's recommended, because when you want to get a diagnosis of COVID, that's the test you want to use, because it can tell you with almost 100% certainty that that person at that particular point in time would have had the virus in their throat or in their lungs or whatever specimen you would use. Then you have the antigen test, which is not as specific, was not as sensitive. And then you have the antibody test, which really measures your body's response to the coronavirus. The issue with the antibody test is that it gives you a result that tells you may have been exposed to coronavirus, one of the coronaviruses. It's not very specific. And it has been reported that for the antibody test, you can have some false positive and false negatives in an amounts greater than with the other tests I mentioned before. But for a clinical, for a real diagnosis of COVID-19, the gold standard is the RNA PCR. And you get the best results with the RNA PCR when the person is symptomatic, and it's now being said that the best time to do that is when persons are symptomatic. And that's what we've done in Antigua and Barbuda. If you're showing symptoms, if you're a close contact of a case, way back in the height of the epidemic, we were concentrating our efforts on persons who were symptomatic and persons who were close contacts of confirmed cases. And we picked up a great number of our cases through that mechanism.
I asked recovered COVID-19 patient Charmaine if she ever questioned where and how she contracted COVID-19.
No, I didn't, but everybody is still questioning me.
Yeah.
And I don't think you can ever pinpoint exactly where you got it from. Yes, there's scenarios that I may have been exposed to at work, at home, on the public transportation that I use, but I don't think we can actually pinpoint where we do get it from. The contact tracing is actually trying to protect others from getting it, because when I called, I said, look, I shared a taxi with my senior nurse on the Friday afternoon when we were coming home. I sat in the back, she sat in the front, so there was a bit of space. It was not air conditioned, it was open air. So the driver of the taxi and the nurse, I would appreciate if you contact them. And we then moved. I went to the prison the Saturday morning. So I was concerned for the officer that came for me and took me back home. But I never saw anybody that morning in the prison. Nobody came to the station. So I felt confident that nobody would have gotten it then. I was just concerned about the driver who came for me and brought me back. So my understanding from the medical point of view of the COVID-19 and the contact tracing is more of a protective rather than a find who you got it from.
How effective is contact tracing?
It was effective. It was a challenge because at one time we had like hundreds of persons we were following. So we had to really get the assistance of a lot of other workers in the Ministry of Health who would have been doing contact tracing in other departments or who had not done contact tracing at all before. So it was a challenge, but yes, we did pick up a lot of cases through contact tracing. And also, I think we were able to control the epidemic in Antigua and Barbuda, because once we picked up a contact, we advised that person to stay at home, quarantine yourself in your room or try to stay away from members of your family, not go to work. It was easy then because we had a curfew. Persons couldn't go anywhere anyhow. So it was very effective and most persons complied.
More and more, we are seeing an acceptance of personal responsibility. As we said before, COVID-19 is still here. We may see new cases, however, how we protect ourselves, our families, and by extension our country is on us.
I feel that as the global research continues in the fight of this virus, that we as a people, we need to try to adopt ways of living in order to stop the spread. And of course, I feel like there are things that we are doing, but I think we need to remain in that state of being COVID conscious. Not necessarily being fearful or having anxiety every day, but just being aware of the fact that we need to live responsibly, we need to live safely. I feel like the government, our administration, have put guidelines in place to help protect our community. And we as a people, it's our responsibility to follow those guidelines. That's the only way that we're gonna actually be able to fight the spread of this virus in Antigua and Barbuda.
I think in general, the local community have adhered to the rules to a larger extent. However, you always have outliers. You always have some persons who have not got all of the information, some persons who have not accepted that the information that's been given to them is true and accurate. And they choose to make decisions which are not based on what our governments are asking us to do. I believe that every country has faced this issue. I believe that what the government here has done in particular is enshrined in the law fines, which has been a deterrent, and they have fined some individuals, which has also been a deterrent. Someone has to pay to ensure that others don't pay. And I think that has worked. From a security perspective, I've driven around in the evenings on my way to my clients, and the roads are empty, and that speaks volumes. You don't have the majority of the people out. They're in their homes, they're all bundled up, locked down with their families, and I believe that we have done an amazing job as a society. And I think that is based on, in my mind, our society is at a relatively high level of intellect, and they're listening and paying attention.
Coming up on Coping with COVID-19 in the Caribbean.
There was some fear and concerns among nursing personnel.
I started to say, man, is this gonna be it? Is it really gonna be it? I'm gonna die without even getting a chance to fight this stuff?
Antigua Barbuda, we got this.
Coping with COVID-19 in the Caribbean is funded by the Pan American Health Organization.